Welcome to the second episode of Nigerian Public Hospitals of Death. In my first video, we talked about the student that was rushed to Luth and was denied access to healthcare on the ground of what's it called? Bed space. And I've said it in that video that it is illegal, criminal for a tertiary hospital not to have bed to manage emergency cases. And I've equally cited the National Health Act, where that criminalizes such stupidity in our health system. Now, I also want to tell you that that patient that died in section 33, subsection 1 of the Nigerian Constitution has amended that every citizen has right to life, and nobody shall be deprived intentionally of his life, save in the execution of the sentence of a court with respect to a criminal offense of which the person has been found guilty in Nigeria. Today we are going to talk about the nurse that died in a specialist hospital in Zamfara. She died in the course of her duty. First, before they employed that nurse, was there any pre-employment medical check? Because that is mandatory. You must check the health status of the person you employ. Was there anything like that? If she complained, they said she complained of heart issue and she slumped and died. Were they able to diagnose it before employing her? That is one. Two, I am aware that health workers' salaries are being deducted monthly for the National Health Insurance Scheme. Does she assess it, or do I say did she assess it monthly, weekly, or yearly while she was working in that hospital? Because I'm saying this, I know most NHIS clinics, even inside the hospital, they don't have drugs. In fact, we know them as a place without drugs. There's no need of going there. You only go there when other options, when you don't have other options. But your salaries are being deducted monthly to contribute for the National Health Insurance Scheme. We are there able to be reviewing her in the course of her duty. That's the second question. Third question is, that hospital, was there any protocol to manage emergency? Because I read where the spokesperson of the hospital, yes, he's being paid to be the image maker of the hospital, bringing out all the lies as if we are, in kindergarten. She complained of what's it called, of a heart issue, and they called the doctor. She slumped immediately. Story. We know the bureaucracy. We know the delay in public hospitals. At times, when I look at public hospitals, people going there, I ask myself, if these people are ignorant, I pity them. The question is, how many people working in that, how many of the healthcare providers, that is health workers now, health personnel, how many of them are set to be admitted in where they are working? Go and check your records. The people that are set are the lower cadre workers that cannot pay for services elsewhere. Your time will be wasted. At times, you see, it's not that I'm against, because the next video, I'm going to talk about the rights of the healthcare, workers. They equally have rights. You understand? I'm going to talk about it. But what I'm talking about today is that hospital. Do they have a protocol, a standard rule, a standing rule or standing order of how to manage emergency? The spokesperson said the doctors were called immediately. That is not true. Let them provide CCTV camera. I'm challenging them. I know how public hospitals work. If doctors are on duty, there may be 3, or let's assume there are 5 in the unit. 2 may be somewhere, the topmost orgas, the ones they call orgas at the top. They'll be somewhere. 3 will be working. You have the first on call, second on call, and possibly third on call. They will be there. And they may have like 7 units or 7 departments, 7 different areas to cover. There's no way 3 people will take care of those places. And if they are having emergency in one place, the other places will be suffering. It's clear. The question is this. Most of our hospitals are death centers, public hospitals, death centers. I wonder why people still go there. Because if not for people that are eating from those areas, most of the things in our public hospitals should have been privatized. Yes, I say so. All these are politicians traveling from here and there. You don't go to public hospitals there. The same people that colonized us and gave us this hospital system, their own hospital system has evolved. Most of the hospitals, most of the universities you hear about, they are either owned by the church or owned by organization or owned by private individuals, and they are doing very well. When somebody gains or gets employment in a public hospital, you go and celebrate because you know you are not going to work. You will go there. There are a lot of mago there. Yes. If what I'm saying, you feel, any association feels that what I've said is against them, you have section 46 of the Nigerian Constitution gives you right to sue me. You can sue me, and then my personal capacity or capacity of my organization. Icon Center for Medical Legal Research. You can search it on Facebook. You understand? So the point there is, does the hospital have a standard protocol for managing emergencies like that? The doctors were called immediately. They are telling kindergarten. The doctors might be in another unit attending to other emergencies before they will reach there. That hospital, do they have defibrillator? Within the next, let's assume 30 meters where that nurse slumped, was there any oxygen? Imagine the story. A nurse checked 30 patients, checked the BP of 30 patients. The vital signs, not only BP, they reported it's vital signs for 30 patients in one nurse. What is the nurse-patient ratio by WHO? It's either 4 or 5. While in some other countries, you have, for the teaching hospital, 3 patients for one nurse. That's for teaching hospital. If you go to general hospital, you have 5 patients for one nurse. The National Association of Nurses and Midwives said the ratio, the nurse patient ratio in Nigeria is 1,160. That's one nurse takes care of 1,160. And at times, when you look at this association to react, they will not react. They will be busy fighting doctors, fighting other health sectors. This is where you have to act. Go to that hospital. What is the nurse-patient ratio? Fight for your people. They have rights. And let me warn you, you healthcare workers, you are afraid. Listen. Thank God the new Hippocratic Oath has changed. They have modified it. Say, I will take care of my health first before taking care of my patients. Because the first principle of life, Bible says, love your neighbor as yourself. It didn't say love yourself as your neighbor. That means you first love yourself before you love your neighbor. Forget about the useless ethics of your profession. Take care of yourself. That time the lady, the report was that she came to work very healthy. Now, in the course of her work, she ended up in the mortuary. Imagine if we allow people in authority to start paying for some of their negligence, they will sit up. Let me tell you, Section 21, subsection 2, clearly mandates any head of a healthcare facility to make sure they set up measures that will prevent their workers from any injury or any theft of their property. At times you hear a doctor comes to work, parks his motor in the car parking lot, and it was stolen. You hold the head of that facility. Section 21, subsection 2. That's what it says. Also, you must prevent them from diseases, getting diseases from the patient they are treating. Today, you see some people that have handled TB patients. Today, they have pulmonary tuberculosis. And of course, do anything, they will try to frustrate you. If you talk, investigation will be set up, and it will be lopsided, to make sure they deal with you. Forget about, it's better you stand before panel of your profession while you are alive than trying to do, I don't want to stand before panel, this. How can a nurse take care of 30 patients? And according to the report, she took 30 patients. That means there might be more. But we have a lot of graduate nurses tramping the streets looking for job. Somebody somewhere is pocketing the money. It is time for you to make case to the state government or whoever that owns that hospital to employ more hands. Because even if we have 10 patients to one nurse, which is still humongous anyway, according to WHO standard of about 1 nurse to 4 patients or 5 patients, let us just assume that we have up to 10. That nurse, that time she was complaining of that stuff. The other nurse would have taken over, but she was afraid of standing before the hospital panel, of standing before any other thing. Her life has gone that way. Next video, I'm going to talk about the Employee Compensation Act. You see, the hospital must be held responsible, and they must pay the family, because I know what it takes to produce a registered nurse. You don't know whether she was the breadwinner of the family. She's dead. And so much. That tells you what they said in the Bible, physician hate thyself. A healthcare worker died in the course of her duty. Hospital could not do anything. That tells you the rot. Yes, that tells you how do I put it? The corruption in the public health hospitals. Thank you. Remember to subscribe, share, comment, and like, so that you can receive the next video, because we're going to talk about this and many more. Thank you once more.
Preview.